Hi, everyone. Thank you so much for joining us for another episode of Adam Interviews, where we are talking to folks in our community doing things of note. We want to thank all of you for getting the Rochester First streaming app, and please tell your friends and family about it. Today, we are talking with Monroe County Executive Adam Bello. County Executive, thank you so much for joining us. We really appreciate it.
It's great to be here with you, Adam. Thanks for having me.
Of course. So one of the reasons that Adam, he's taking time out of his extraordinarily busy schedule to talk with us, because we had the closing of Waterview Heights, as we've been talking about, and you have close to 200 residents that come August 25th, they're going to need a new place to stay. This follows the Danforth and Hudson Ridge Towers closing, and Northfield and Parrington. I talked, Adam, yesterday with Anne Marie Cook. I know you two work kind of hand in hand with a lot of this stuff. She's with Lifespan. She called this a nursing care crisis. Do you agree with what's happening right now?
Yeah, I actually think we are in a very challenging time for long-term care and nursing home availability, because at the end of the day, here's a statistic that I think will alarm a lot of people, but there are over 1,000 nursing home beds in our region, not just Monroe County, but the entire Finger Lakes region, that are licensed but unstaffed and not open and available. And there's a number of reasons for that, which we can talk about today, but at the end of the day, that's what's driving the challenge that we face. And because of that nursing home, one of the things I've learned in this business is that sometimes when you look at an immediate crisis or an immediate challenge, in order to solve it, you have to start looking upstream. And one of the things that I think is particular note is that it's because of the challenge that we have in our long-term care facilities, like our nursing homes, that you're actually having these backups in the hospitals that a lot of other people who would never have another connection with a long-term care facility are facing. So when you go to an emergency room and you see that emergency room packed, you have to trace its roots all the way to the challenges that we have in our nursing homes.
And I think that was the message that I tried to get out there yesterday, which is that you might not have a loved one in long-term care, or you may not be facing that yourself, but this could impact you if you get into a car crash.
Yeah, that's absolutely right. Because at the end of the day, so one of the things that, and this is how it actually first came to me and on my radar, and why the county started doing some work here, which is not a space that counties typically operate in. Counties don't usually do a lot in this type of healthcare space, working with hospital systems, and also, frankly, in the way that we're working with long-term care, centers, because but it came to me because it was starting to really impact how a lot of residents were interacting with the hospitals. Because if you go to an emergency room, and I actually saw this myself when a family member was unfortunately hit by a car several years ago, probably 3 years ago now. I went to the emergency room, and it was shocking, the number of people who were lined up in a hallway. And from there, you start having conversations with the hospital leadership, and they're reaching out for help. And what we came to learn was that the hospitals were operating at over 100% capacity, largely because when somebody goes into the hospital for an issue, let's say it's an issue that then requires rehabilitation, right? So like maybe a broken hip or something like that. The acute care that they need is taken care of in the moment. They're in the emergency room, they get admitted, they go upstairs into the hospital. But if there's not a bed to discharge them into a nursing home for rehabilitation care, or if there's not the proper home care to discharge them to, because a hospital can't just discharge somebody, you have to discharge them to a safe environment that's going to provide them that follow-on medical care. And if they can't do that, then they have to remain in the hospital. And so now you have that resident, that patient who should be a resident at a long-term care facility or be able to go back home for home care back out in the community. They now remain a patient in the hospital, taking a hospital bed away from another acute care patient who's probably now stuck in the emergency room because there's no bed to admit them to upstairs. And it creates this whole long backlog throughout the system that if you've been to a hospital over the last few years, you've seen it with your own eyes, but it wouldn't necessarily be evident to you that the issue is actually on further downstream to the nursing home side. It's not actually the hospital issue, it's a nursing home issue.
And I don't think a lot of people, including myself, realize that. I think the COVID pandemic really highlighted this because it kind of exacerbated the problem.
Yeah, it really did. It really did. And because what happened was you saw nursing homes close, you saw staffing shortages like you've seen in a lot of industries as the result of COVID. And we were already underbedded to begin with. We have fewer nursing home beds, we have fewer hospital beds than other regions per capita, than other regions across the state. And so we already were facing I don't want to say a crisis like that, but we were already kind of on the razor's edge when it came to the availability of beds. And so when you have something like COVID hit that then sort of rearranges the deck chairs, if you will, right, in terms of staffing levels, workforce availability, things like that. And then also we should talk about the cost of providing care as well. When you start and when that cost starts to increase and the reimbursement rate to provide that care doesn't move, all of those factors combined to create a real sort of toxic situation here that we find ourselves in.
There's so much to touch on here, but first the cost. I think Anne Marie was saying $18,000, if not more, per month to care for someone in a long-term care facility. That's incredible.
Sure, it really is. And, Monroe County actually operates one of the largest nursing homes, not just in New York State, but across the country, at Monroe Community Hospital. It's a wonderful facility, and we are licensed for around 550 beds. That's a very large nursing home, and we take a lot of Medicaid residents there, right? Because there's a couple different ways that long-term care is paid for. There's private pay, and there's Medicaid. And the Medicaid rate, because it has fallen so far behind what the actual cost of care is, we lose over $200 a day caring for Medicaid residents at Monroe Community Hospital. And that's how long-term care facilities across the region are operating. And so what ends up happening is that nursing homes have to make decisions around, well, they do a couple different things. One thing is they do sort of balance private pay and Medicaid residents, so that, and that frankly, they're being charged different rates, right? To stay at the same place if you're private pay versus Medicaid. And that could be shocking to some people, right? The other thing that some long-term care facilities have done is that they've put other options near their facilities, right? So there could be more assisted living or independent living that have different rate structures that help to drive for lack of a better term, profit that then helps to underwrite some of the losses that they might experience on the nursing home side. So there's different business models that help them to survive. But at the end of the day, the Medicaid rate has fallen so far behind in the reimbursements that it's costing nursing homes too much money to then be able to increase the salaries, be able to pay what they need to pay to expand the number of beds and turn those over 1,000 beds that exist and are licensed, but they just can't turn the beds on because the money is just not there and the economics don't work.
I think it speaks to how large this issue is when it comes to how well versed you've had to become in this topic.
Yeah, I know more right now about long-term care than I ever thought I would.
Right?
This was
Exactly.
this was never part of a campaign platform, really.
Yeah.
Good job.
Yeah.
But it's a big community need at the end of the day, and it's a place that we could help because we do have access to Monroe Community Hospital. So there is we do have a talent base here and some institutional knowledge to be able to help. And it's a community problem. So just like anything that impacts the community, we're going to lean in and try to figure out how we can solve it. So when the problem really started presenting itself a few years ago, I had an opportunity to meet with and pull together representatives from the two big, large hospital systems, representatives from long-term care institutions, the state government, and we pulled them all together and said, okay, here's the problem. Let's get creative to figure out how we can drive solutions. And so what we came up with was a program that we called the TC3 program. And we utilized some American Rescue Plan dollars that Congressman Morelli and our U.S. senators had secured for us, and we leveraged those dollars with some other dollars, private dollars, to create this program. What the program did was helped pay essentially block grants to local nursing homes to help cover the cost of caring for long-term care residents. So whether that was equipment needs that they needed or things like that, that were basically prohibiting them from turning beds on. And basically we're able to help open up hundreds of additional beds throughout the community. So by covering sort of these costs that they had no other way of being able to cover. TC3 program also invested in workforce development and training to help to be able to train new certified nursing assistants, and, which are otherwise known as CNAs, that could work in long-term care facilities. Again, those are in short supply around here. So we invested in a few different areas like that, and we were able to be able to move over 500 in the first iteration of TC3, over 500 patients from hospitals into long-term care facilities that otherwise would not have been able to move. And it worked really well. But then, of course, those dollars start to dry up. And so we started looking for additional money. And last year, New York State, seeing the benefit of the program that we created, allocate an additional $15 million that would go through Monroe County to turn on TC3 program again. We're calling it TC3 3.0. That would do essentially four things, or a few things. One would be to, again, help with the discharge process, so be able to do the block grants to the nursing homes. It would also invest in prevention. So I know you talked to Anne Marie Cook, but we wanted to be able to leverage Lifespan's Community Care Connection program, which helps people basically prevents people from going into a nursing home that don't really need to be in one in the first place. So again, it's a prevention program. We did a discharge navigation program to help get people out through the nursing home, because once you're in a nursing home, that doesn't mean you have to stay there. You might be a short term, so let's get you back to your home. And then the other creative thing that we found, again, by bringing people together and learning about this, is that there is a distinct need for dialysis care in our community. We actually need
Interesting.
dialysis. And one of the things that is really prevents long-term care facilities from being able to open up more beds is actually nursing home residents that need dialysis. It's enormously expensive to provide that transportation from a nursing home to a dialysis center, which we don't have enough space for to begin with as a community, and then back to the nursing home and get it all scheduled. It's really not a great system. So we're going to invest some of that $15 million into a dialysis center on site at Monroe Community Hospital, so that we're going to be able to take people who are stuck in a hospital, because that's the only place they can get their dialysis treatment, but they really don't need to be in a hospital. We can get them out of the hospital into Monroe Community Hospital, free up the bed in the hospital, and give someone a wonderful place to live at MCH, where they can also have access to dialysis care that they need.
So, okay, so lots of questions here.
Yeah,
This
sorry,
is,
that was a lot to get
no,
here.
like I
Yes.
said, again, it speaks to the incredible size of the problem that, the county executive has been forced to learn so much, get in the weeds like this. So with the dialysis center, when do you expect that to be open at Monroe Community Hospital?
Let's see. So I think we're probably expecting it for next year. We just actually had the lease agreement with our provider over at URMC was just approved by the county legislature this week. And then we need to do the build out there. So there's some
Mhm.
construction that has to happen. So I would say later this year, early next year.
And then going back to, I think what you're saying is that we have the space, right? The physical space to house a lot of these residents slash patients, but it's about turning on that space so it's available. And that's really comes down to reimbursement. And just so folks know, what happens is the state through Medicaid will reimburse long-term care facilities for their pay. Of course, Anne Marie Cook, a lot of people in this field will say those reimbursements don't match what it actually costs to cover, which is what Adam was just talking about, $200 extra a day just for Monroe Community Hospital. So
Mhm.
let's talk about the reimbursement rates. I mean, you're in the political sphere. You
Mhm.
talk with the lawmakers in Albany. You also have your finger on the pulse of what's going on in DC. What's the realistic probability of getting a higher reimbursement rate?
Well, that's a good question. So this year, New York State did increase the reimbursement rate a little bit. So it did go up slightly. I don't remember the number off the top of my head, but I know that it would probably bring in another $2 million ish to Monroe Community Hospital as revenue. But we're still at that $200 a day number as a loss because costs just keep
Right, of course.
going up. So I don't have a lot of optimism actually that it's going to go up enough to cover those costs. Simply because we're actually seeing a pullback on a national level in investments in healthcare. And so I have a lot of concerns around this, around Medicaid funding, and that's the funding mechanism here is Medicaid. And that does flow from the federal government to the states down to the counties. So I don't have a lot of optimism there. So that's why we have to start thinking creatively around how to um, cover costs for long-term care facilities, how to help them be able to balance their private pay versus Medicaid residents. And then also think creatively around what are the other barriers that exist. So that's why the prevention was important because there's a number of people who end up in nursing homes that really don't need to be in nursing homes. They really can stay at home if they had the right proper care. Or if they had the proper care at home, they wouldn't end up in a hospital that then leads to a nursing home. So the preventive care, I think, is really important because it's cheaper and frankly, it's a better place for people to be if they can avoid going to the hospital, right? So that's important. Other issues like the dialysis center, that was not on my radar a few years ago. That was brand new to us, and it just seemed to make a lot of sense. And so again, it's like these weird issues keep popping up where you're like, well, maybe we can invest in that, and that might help. And then also the discharge navigation. So again, you have people who are in a hospital, really should go home, but the discharge planning isn't correct, or you're in a nursing home and you really don't need to be there anymore. Let's figure out how to discharge you from the nursing home so you're not stuck. So we actually have an opportunity to not just look at it and just blame the state or federal government for not increasing the reimbursement rates enough. Obviously, there's responsibility there, but we have an opportunity to say, okay, let's just not sit back here and blame people. Let's think creatively, innovatively about how we can try to impact this in other ways. And so that's why we decided to invest not just in the block grant program, but also these other areas.
So it's called TC 3.0 right now. Is that kind of what
Three.
you're?
Yep, it's TC3 3.0,
Okay,
and
3
it's launched
3.0.
now. And so far, like I said, in the first couple iterations of TC3, we had over 500 residents. Now we have over 600 that have been moved to date since we started the program a couple of years ago. But the program really does work. It needs to be scaled, but we do really need to have a long-term conversation around what what is the future of long-term care?
Mhm.
Because we're we are able to pull together what started as a pilot program, which now looks like a program that really is working and having an impact. But it's sustainable because we received federal grant dollars the first go around. We've received state grant dollars now for this go around. But it's really largely reliant on these outside dollars. These aren't areas that counties are really set up to be funding ourselves. we don't have the kind of dollars to fix this problem. And so there really does need to be a conversation around long-term sustainability of doing something like this.
So, do you think that there's an opportunity for the county to offload this to a nonprofit or another agency that's more capable, or not capable, but it's maybe they can concentrate on something like this?
Yeah, we are working with Common Ground Health, Flips, the Rio. So we are working with nonprofits to help manage this, right? So the county
Hmm.
doesn't actually manage we took in the funding, and then we're working with nonprofits and the hospital systems to actually manage the flow of the dollars. So, and even like the dialysis center and MCH, working with URMC on that. So we're leveraging all those community partners. But unfortunately, what this really does come down to is funding. It really just comes down to that. Other challenges, I'll just throw another log on the fire, Adam,
Hmm. Yeah.
is staffing. One of the things that happened during COVID, coming out of COVID, because we mentioned that earlier, is staffing levels at nursing homes. They were very challenged during COVID. And so the state passed new regulations around minimum hours for certified nursing assistants, so CNAs, RNs, LPNs. So there's minimum staffing that every nursing home resident, minimum staffing care hours that every resident needs to have under the state law, and there's penalties if you don't meet that. Now that's a good thing, right? Because we want our residents to have a certain standard of care. But what it also did was increase the cost on the nursing homes to be able to provide that care, because now they had to make sure that they had X number of staff. I think it's 3.5 nursing hours a day, something like that. For all of their residents, which they didn't have before. So now they have to staff up. Staff is in short supply, so now they're competing with each other for that staff. That also then increased the cost, and that's another factor that's driving the mismatch between the Medicaid reimbursement rate and the actual cost, because the actual cost is now also being driven by the increased labor cost, where Medicaid reimbursement didn't increase at the same rate.
Yeah, and of course, going back to your other point about preventing people from going into long-term care, that goes into home care workers as well. And we've done a number of stories about the lack of home care workers. So
Yeah. It's tough
it's,
because in
yeah,
home care, there's a whole nother series of challenges around there, because they can be lower wage jobs, but you have to have reliable transportation, right? Because you have to
right.
be able to go to cars. So there's a lot of challenges and this is something that's just sort of interesting about a lot of things, Adam, that you cover in the news and things that I'm learning here in my job still, is that what you think is the problem isn't always the problem.
Hmm.
It might be a symptom of the disease, right? And so
Right.
looking at, why are hospitals so overwhelmed? That's a symptom of the disease of long-term care bed shortages, right? And the same thing happens with home care. Why is that so short? Well, it's because we need more reliable transportation. You have to invest in training because there's a cost associated with getting that type of licensure, right? And so there's a lot of different challenges.
Yeah, it's incredible. Do you think, I was telling Anne Marie yesterday that I always feel weird asking these questions because it just seems so sci-fi. But when you talk about AI, robotics, you talk about transportation, something like Waymo coming in, can it help home care workers get to where they need to go? Can it help patients get to dialysis centers, or then even care within the facilities? You talk about, you look in Japan, you kind of see different things that might be coming our way. I mean, is that something that we can at least rest some hope in at this point?
Well, it's certainly an opportunity for the future. It's interesting that you brought that up, because the county, we just launched this AI work group, this task force within our county government that will have, obviously our IT department, certain department heads, but also outside experts as well. We just launched this task force to really sit back and look at what are these different AI supported software programs that are out there that could actually enhance our ability to do our job, but do it safely, with the right safeguards, protections, and all that in place. And so certainly, I think that as we continue with that process, looking for things, there are ways that that new technology can be used. I think we need to embrace technology, but we also need to make sure that we're doing it in a way that's obviously safe from those outside actors that might be looking to do harm.
Yeah, that battle that's coming is going to be intense. When it
Is
oh yeah, it's so now when you go to Waterview Heights, I bet you basically hear Sarah Clark, you hear Representative Jennings. So basically, what I got from that is that it needed to close. The complaints have been very bad for years. At the same time, 170 people possibly. What do you think when you hear about the closure of this place?
All right. So a couple things. First of all, some of the stories that I've been hearing out of there are alarming. There needs to be some accountability there. And I'm glad that the state is stepping in because they have a responsibility, just like every long-term care institution, to take proper care of their residents. And if that's not happening, they need to be held accountable. I've spoken to the state about what the next steps are there because at the end of the day, this is almost 200 of my constituents now who are feeling anxiety about where they're going to be able to live. And there's now also anxiety amongst the entire healthcare system around where nearly 200 people are going to go in a system that's already incredibly stressed. So we started by looking at, I called New York State representatives yesterday and actually a couple days ago. And then we've also been talking to the healthcare systems and of course Monroe Community Hospital to see how we can be helpful. And so we're already working to bring institutions together. That's one of the roles that county government can play, is convening people to figure out where we can be helpful in leveraging all the resources here. And while that's taking place, the administration at Waterview Heights is required right now to be putting together a plan with New York State to present to New York State on what the closure would look like. And so it is incumbent upon them to create a plan that would essentially move their residents to other facilities that can take them. So I know they're working on that right now as well. And so all of these things will come together over the next several weeks. And the county will obviously play whatever role that we can to make this as safe as possible for everyone. But this is a really terrible situation that's developed for the residents that live there, their families, and the stress that it's creating on people that is unnecessary. But I don't know. I'm just really disappointed in this facility. I mean, when you have a loved one that is put into that needs to be put into a long-term care facility, there is an obligation and responsibility that facility has to take care of your loved one, and you are putting a lot of faith and trust in them. And so to have that faith or trust violated, to me is just an outrageous thing. And so we really all do need to come together, the levels of government, but also the hospital systems and the long-term care community, to figure out how we can support those residents the best we can.
Is there the facility you talk about moving them? Are there beds available?
Well, that's what we're in the process of trying to find out. And then what would it take to do that? So one of the things that we're looking at Monroe Community Hospital is that, of those 1,000 beds that are licensed but not open, 100 of them, over 100 of them, are at Monroe Community Hospital. So we have space there. We just don't have the funding, and that was part of the conversation I had with the state this week. But every nursing home across the community is going to have a similar story. And so inventory is going to have to be taken right now into who has what space available. And then we have to figure out what those funding needs are. So those are the conversations that are happening now.
Very good. Well, Adam, Bello, this conversation could go on, so maybe we'll invite you back in a week or two to kind of finish it up. But I've taken up a lot of your time, and I can't tell you how appreciative I am to get in the weeds with you, because this is clearly something that you've been paying a lot of attention to.
Thanks for doing this. This really is an important conversation that really does impact, as we talk about with the hospital system, too, impacts everybody in our community. So I'm really appreciative that you took the time to focus on this.
Of course, County Executive Adam Bello talking with us today about the nursing care crisis. And that's the word that keeps coming up. And of course, the Waterview Heights closure just impacting that even more. So thank you so much for watching. Again, tell your friends and family about the Rochester First app. And we will continue to put on good content. And hopefully you can learn a thing or two like I do every day. All right, everyone, take care. We'll talk soon.
Get the Rochester First streaming app today for everything you love from News 8 On Demand, plus exclusive shows you won't see anywhere else. Search ROC and download for free on Roku, Amazon Fire, and Apple TV.